Good morning or good evening, everyone. My name is Gustavo Saposnik. I'm the editor-in-chief for the World Stroke Academy for the World Stroke Organization. Today, we have the unique opportunity to interview the president of the World Stroke Organization, as well as the chairs who developed the systematic review for the guidelines of the stroke for the World Stroke Organization. So if it's okay, can you introduce yourself, Sheila?
Hi, I'm Sheila Martins, a stroke neurologist from Brazil, and now I'm the president of the World Stroke Organization. It's a great pleasure to be here with you.
Thank you, Sheila. Gillian.
I'm Gillian Mead, Professor of Stroke and Elderly Care Medicine at University of Edinburgh in the UK, and I co-led the World Stroke Organization Guideline Committee to produce this review, and it's a pleasure to be here.
Thank you, Gillian. Alejandro.
Yeah, Alejandro Rabinstein. I was the other co-lead following Gillian. I'm a stroke neurologist at Mayo Clinic in the United States.
Excellent. So the first question is for Sheila. After having this significant amount of work done by the Guidelines Committee, so how the organization takes this work? So how relevant or important is this work for the World Stroke Organization?
Well, these World Stroke Organization guidelines are a huge contribution to the stroke services. Guidelines are so important to really guide the services to implement the protocols, evidence-based. And the idea is it's very important, but it's not easy task to create the guidelines. So this guideline can contribute to the countries to have evidence-based created by a strong organization as World Stroke Organization. And we can link these guidelines with the implementation task force that we created last year with more than 100 people distributed in different parts of the world, working to implement, to develop stroke services and to qualify them, working together also with the certification of stroke service. So the idea is to use the guidelines that are recommended in different levels of stroke services with this international task force.
Thank you, Sheila, much appreciated. And then, Sheila, people is going to start reading the just published systematic review, but can you elaborate a little bit on what was the process or the methodology and the objective of this work?
Shall I just answer that question? So I was invited to be co-chair of the WSO Guideline Committee along with Alejandro about 3 years ago now, and our remit was to update the previous guidelines that had been written by and been led by Patrice Lindsay. So we decided to do a systematic review of all stroke guidelines, and we developed a protocol and published that on Prospero. And our goal was to identify all stroke guidelines that had been published since Patrice's work, which had been published in 2014. So we did a systematic search, imported references, screened them, and then obtained articles which fulfilled our criteria for guidelines. And then we divided our group into 3 groups, one looking at acute care, one looking at secondary prevention, and the other looking at rehabilitation. And then we identified the relevant papers for each group and extracted data from them and also evaluated their quality. So it turned out to be quite a big job. We identified about 200 publications that we scrutinized, and we extracted the strong recommendations from those and then made judgments about which of those recommendations were appropriate in different levels of healthcare settings. And the idea of that really was to help with implementation. And we also looked at some of the limitations of guidelines in terms of the methodology, but also in terms of the areas covered that were important to stroke survivors and healthcare professionals.
Thank you, Gillian. That's great. And the next question is for Alejandro. Alejandro, can you comment on the gaps that you identify, gaps and barriers, and what were the main findings? And especially having the perspective for the general neurologist or stroke neurologist that is practicing somewhere else.
Well, I mean, one of the things that we noted is that particularly for acute stroke and to a lesser degree secondary prevention, much less so for rehabilitation, the strong recommendations across guidelines were actually quite consistent. The verbiage may change, but the actual evidence-based recommendations were quite consistent. It was a little bit disappointing to see that there was a lot of copy and paste from guideline to guideline, where clearly the better known guidelines were sort of, I wouldn't say plagiarized, but certainly they were too close to one another, and guidelines of individual countries or regional organizations, instead of focusing on what matters to their country or their region, just translated the evidence without any effort at making it more applicable. I want to highlight that in the work that we did, we separated the recommendations into those applicable to basic, essential, and advanced services. So at least there is an approximation as to what different centers in different parts of the world can think that they should be doing. And we also proposed some metrics to follow quality. Gaps. One of the gaps that we identified is the lack of patient representatives as part of the writing groups. Another gap is the lack of a plan for dissemination, implementation, and monitoring of the guidelines that ideally should be part of the guideline development itself. And then in terms of topics, there were some topics. Certainly, I took care of the part of the acute part. It was much more developed and more consistent than secondary prevention. And Gillian can talk more about the gaps in terms of rehabilitation. And overall, the impression that we got was there is a lot of redundancy. There is still a need for more timeliness. Let's say the recent large court trials, they are not included in any of these guidelines, yet they are likely going to change practice. So we ended up with the notion that we would like to promote the idea of live global stroke guidelines as the ultimate objective that would improve the dissemination of knowledge in stroke in general.
Thank you, Alejandro. Gillian, would you like to add anything regarding other gaps that you noticed?
I was leading the rehabilitation section, and what was striking was that there was strong recommendations for stroke unit care, for early supported discharge, for exercise training, task-specific training, amongst other things. And I think the challenge there is to implement that, and certainly not everyone has exercise training and early supported discharge services. But there are also some very significant gaps in relation to things that matter to patients. So cognitive impairment, for example, fatigue and apathy and post-stroke pain. There were no strong recommendations, and yet those are very common and distressing problems for people longer term after stroke. And also it was interesting, there were no recommendations about end-of-life care after stroke, which is, again, is perhaps surprising given the high case fatality of stroke, although of course people may be extrapolating in clinical practice from other areas, and that might be appropriate. So those are the other gaps that I would like to highlight.
Thank you, Gillian. That's very thoughtful. So I remember that before we all talk about your mandate of trying not only to develop this systematic review, but you were more concerned about the implementation and monitoring. Can you comment on that? So what do you think it should be done to best implement some stroke guidelines? This is an open question to the three of you.
Shall I just say, from my perspective, dissemination is important, and we've got a platform presentation coming up at the European Stroke Organisation, which is excellent. We're going to be doing a webinar and also some e-learning modules. So dissemination is the first stage. And then we want to work with Sheila's task force. So maybe I should let Sheila speak to what that might involve.
Well, yes, I think the international task force will be very important. And this task force includes a strong educational program that can help a lot to disseminate the guidelines. We are creating a teaching course for the hospitals that will include the new guidelines. And as Alejandro told, we have a problem because just publish new papers and new evidence, and the guidelines did not include yet. So I think the idea to have a live guideline online to be updated each month or each 2 months and link it to the implementation recommendations would be unique, and we will do it. I think is the way to go to disseminate and to be always updated and really disseminate the best knowledge to everybody. I think will be a very important tool, useful to have handy all the time.
Thank you, Sheila. Alejandro, any other comment?
No, I think that we covered well what we have done and what we would like to happen with the work that has been done. I truly hope that eventually we abandon the turfs and we all work together with the ultimate purpose of creating a big community, a big stroke community with the right academic tone, the necessary patient representative participation, and a structured system that allows for recommendations to remain updated and to be adjusted to the needs of different people in different parts of the world.
Thank you, Alejandro. Well, we are, working towards that goal. From the WSA, we are working together with the with ESOC, the American Heart, and hopefully with more and more organizations. So we are trying to embrace that idea. So to conclude, any final comments or that you would like to make?
I think I would just like to make a plea for more primary research in areas of life after stroke that matter to patients, and perhaps there is a role for us to lobby funders to commission more work around these really important areas that are so disabling for stroke patients and their families as they come to terms with life after stroke.
Yeah, people with life experiences included in the in those guidelines and perspectives. Any other comments?
Well, I would like to invite every stroke expert in different fields that want to join the implementation task force. You are welcome. We need a lot of people to help us to disseminate the right knowledge to the world.
Thank you, Sheila. We are very supportive. So thank you very much,
read the
everyone.
paper.
Of course, of course. Actually, we can share. It's already published in IJS, and very interesting points that are made and as major recommendation based on the systematic review. So thank you very much, everyone. It has been a pleasure to speak with you today. and I commended you on behalf of the WSA and WSO for the amount of work that you have done. Great leadership and great work. Thank you.
Thank you.
Thank you. Bye-bye.